This facility had over 300 beds in 2020 as it accommodated COVID-19 patients during the pandemic. It's now been converted into a 128-bed General Transitional Hospital. Some of the over 200 healthcare workers on the verge of losing their jobs are calling for the renewal of their contracts.
The unfortunate part from the government of Western Cape is that they want now to replace these workers that have been working here for almost 3 years. That is why they are demonstrating here. It's because they don't know what is going to happen with their families now, because they depended on this. This is the only bread that they have. They are not working anywhere else. We are talking about here nurses, we are talking about doctors, we are talking about admin staff, cleaners, and everybody that is employed.
Minister Mbombo says the problem is not only in Brackengate, but it is widespread and it emanates from budgetary constraints.
With the equipment, with the everything, supply chain, plus the staffing related to the COVID, all of that disappeared at the end of 31st March, not only for Brackengate, but everywhere else in the whole province was managing the COVID. The provincial treasurer gave us 1.48 something billion to cover that shortfall, but remember, there's no increase. And 1.4 billion without increase, just to cover that part. Whilst we are still looking in terms of how to rob Paul and pay Pauline, just imagine, it's still shortage. Now we are being hit hardest now by the 7.5% agreement between the Department of the Public Service admin, plus also the unions in regard to the wage bill.
The hospital, taking care of patients recovering from chronic illnesses, was piloted last year with over 100 beds, but it is now operating with 60 beds. The department says this transitional facility in Brackengate and 3 other facilities in Paarl, George and Beaufort West are being prepared to decongest the acute hospital platforms.
We've now set aside 96 million rand to run this facility. That's the operational cost for a year. It's essentially designed now as for 128 beds, but at the moment we're running 60 of the 128 beds. And the intention really is to decongest the acute hospitals, and we really want to make sure that we take patients who are not ill enough to be in an acute hospital, but at the same time they're not sick enough to be discharged home.
The health department says it remains severely understaffed across the province. The department's lease ends on the 31st of January 2026, and it will then weigh up operational costs on whether to continue or build its own facility. Athule Joga, SABC News, Cape Town.